Hi, I'm Dr. Frederick Echols, Acting Director of Health for the City of St. Louis. As schools begin dismissing for the semester and summer day and overnight camps begin opening, the City of St. Louis Department of Health is reminding camp administrators and camp staff to make sure they are following Centers for Disease Control and Prevention guidance to help prevent the spread of SARS-CoV-2, the virus that causes COVID-19. This week's questions provide a summary of some of those guidelines, but the guidance should be reviewed in its entirety and can be found on the CDC website. Darnell from zip code 63115 asks, should campers and camp staff wear a mask? The Centers for Disease Control and Prevention guidance provides that campers who are fully vaccinated do not need to wear face coverings. On the other hand, camp programs should encourage people who are not fully vaccinated and those who might need extra precautions to wear a mask consistently and correctly. Exceptions to the recommendation to wear a face covering applies to children under the age of 2, individuals with disabilities who cannot safely wear a face covering, and persons for whom wearing a face covering would create a risk to workplace health, safety, or job duty. In general, people do not need to wear a face mask when outdoors. However, particularly in areas of substantial to high transmission, people who are not fully vaccinated are encouraged to wear a mask in crowded outdoor settings or doing activities that involve sustained, close contact with other people who may not be fully vaccinated. Camps should be supportive of campers or staff who choose to wear a mask, particularly in areas of substantial to high transmission. Camps may consider requiring mask use indoors by all people present, including vaccinated campers, staff, and other people such as visitors. Daja from zip code 63107 asks, should camps require social distancing? Although people who are fully vaccinated do not need to physically distance, camps may choose to implement physical distancing for all campers and staff, including those vaccinated and those not fully vaccinated. Physical distancing provides protection for staff and campers who are not fully vaccinated by reducing risk of exposure and limiting the number of close contacts. It is also recommended that camps consider cohorting campers. By placing camp attendees in small groups who stay together throughout the day, group members will have minimized exposure to other group members at camp. Although the use of cohorts can limit the spread of the virus between small groups, this practice should not replace other prevention measures within each group, including wearing a face covering. Melissa from zip code 63110 asks, are health screenings really necessary for camp staff and campers? Health screenings are highly recommended for camp staff and campers. For children in day camps, consider strongly encouraging a parent or caregiver to monitor their children daily at home for signs of infectious illness, including COVID-19. Encourage parents or caregivers to keep campers with signs or symptoms of infectious illness home when sick and/or seek medical care. Staff should self-monitor and should not report to work if they are ill. For children in overnight camps, daily health checks should be completed. If feasible, the checks should be done by the same staff member who knows the child and their health status. If a camper has signs or symptoms of infectious illness, including COVID-19, the camper should isolate in a designated area and should be evaluated by a camp health staff. Camps should have plans that includes protocols to follow for contact tracing, isolation, and quarantine guidance. Weekly screenings should be conducted of staff who are not fully vaccinated and who may oversee multiple cohorts of campers over the summer to help identify those who might be asymptomatically infected to prevent further transmission. It is important to educate camp staff, campers, and their families about when and why they should stay home and when they can return to camp. Thank you so much for tuning in this week. I look forward to joining you next week for more critical public health information. Let me hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.